bowel syndrome is not a disease, but it's a functional disorder that affects the lower gastrointestinal tract, means your small intestine and large intestine, causing a cluster of symptoms such as abdominal pain, bloating, gas, diarrhea, or constipation. These cluster of symptoms are together named as IBS. Since IBS is not a disease, there are no definitive tests to diagnose it. But we can diagnose the IBS based on Rome 4 criteria and your symptoms. According to Rome 4 criteria, if an individual is experiencing changes in the bowel habits such as constipation, incomplete evacuation, mushy stools or diarrhea, along with the symptoms like urgency to pass bowels, abdomen pain, gas, bloating, persistent for over 3 months, then it is diagnosed as IBS. IBS is classified into 4 types depending on your bowel consistency. Type 1 IBS-C, where you experience more of constipation. Type 2 IBS-D, where your stools are mushy or you have this diarrhea type of stool. Type 3 IBS-M, you experience both constipation and diarrhea. Type 4 IBS-U, which is unclassified, your stool consistency is very indefinite. We have to understand the possible reasons that can lead to irritable bowel syndrome. Number 1, our gut has a balance of good and bad microbiome, but lifestyle choices such as alcohol, smoke, stress, inadequate sleep, or your dietary choices like frequent consumption of restaurant meats, processed and junk food will allow the bad microbiome to outgrow the number of good microbiome. This imbalance can turn your gut into an infectious environment. Number 2, post-infective IBS cases, where immediate infective symptoms like diarrhea, nausea, vomiting or fever occurs due to consuming contaminated foods. This is introducing pathogens into your body. These cases are called as post-infective IBS, where you see predominantly diarrhea happening to you. Number 3, you being an anxious person dealing with a lot of stress, trauma in your life, which is impacting your gut-brain axis and possibly leading to irritable bowel syndrome. Number 4, chronic medications. Prolonged usage of antacids, antibiotics can disturb the gut microbiome. The combination of antacid and antibiotics can also impact the stomach acid, giving you a slow symptoms of indigestion, bloat, burping, and antibiotics killing the good microbiome. Together of this uses can induce constipation, incomplete evacuation, or mushy stools, which can slowly manifest into irritable bowel syndrome. Number 5, it is not just the bacterial overgrowth. We might have fungal overgrowths, protozoas or virus, pathogens or worms, which can lead to chronic irritable bowel syndrome. So I would advise you to work with a certified IBS dietitian who can help you to navigate exactly what infection you are dealing with. Managing IBS often involves a combination of lifestyle changes, dietary modifications, stress management techniques, and therapeutic supplements. As IBS has an underlying cause of pathogen overgrowth, just being on elimination diet would not help you. You have to add the appropriate therapeutic supplements to address the overgrowth, poor or hyper gut motility, and nutrient deficiencies. Treating the symptoms of IBS without understanding the cause and consequence will not help us to find a solution, and do not overdo on medications as they can alter the ecosystem and functionality of your gut. To be precise, irritable bowel syndrome is a condition that mainly impacts the lower GI tract due to an imbalanced gut microbiome impacting your gut motility. Certain infective microbiomes produce methane or hydrogen gases which can slow down the gut motility, resulting in constipation, incomplete evacuation, or they produce hydrogen sulfide gases which can lead to mushy or diarrhea type of stool. The imbalances gradually affect stomach acid, causing symptoms like indigestion, bloating, burping, abdomen pain, and chronic infections can lead to pancreatic insufficiency, which is one of the undiagnosed cause of chronic diarrhea. In 70% of IBS cases, overgrowth of infective microbiome in the small intestine can prevent the absorption of fat-soluble vitamins and fatty acids. So despite of eating a clean diet, this may manifest as a dry skin, brittle hair, dry lips, urgency to pass the bowels after your meal. And additionally, low stomach acids, worms, parasite infections can lead to B12 and iron deficiencies, resulting in the fatigue and headaches. With dysbiosis, the body may struggle to metabolize vitamin K, biotin, and other B family vitamins, as a healthy gut microbiome help in absorption and metabolism of these vitamins. The unwanted microbiomes produce harmful gases that can damage the gut lining, allowing the toxic and metabolic waste to enter into the blood circulation, which can lead to autoimmune disorders, weaken the immune system, causes weight loss, and increases your histamine intolerances, eventually ends up with leaky gut. The inflamed and infected gut do not allow the nutrient absorption to happen. Instead of simply treating the symptoms with medication, focus on comprehending the root cause and effects of IBS on your overall health. By addressing the underlying factors, you can gradually restore your gut functionality